Welcome back to Momentous Living. I'm Kevin, and today we're here with the infamous Susie Saltarelli.
A lot of pressure.
Yeah, well, we got a little past. Susie was a client of mine back in the day, and we were both addicted to, I guess, anatomy and science.
It was like the human body.
We were like trying things, and she'd come in with all the new stuff she's learning, and I'd get either corrected with hypotheses that I had, or we would discuss things, and it was just so much back and forth. And it was like, for you to say when you're in school, one thing I always will remind myself is they say the best way to learn is to teach.
Yeah.
But it's also discourse.
Yeah.
And I think we were very privileged to have each other in our journeys.
For sure.
So you are a physiotherapist, pelvic floor specialist.
That's
Is
right.
that okay to say that?
That's fair.
Okay, so for people who have no idea what that is, and I don't know much.
Probably most people.
I just know my tag test pelvic floor type of stuff.
The stress.
The stress. But how about you give us like a little bit of a brief explanation about what exactly is it?
Yep.
And keeping in mind that pelvic floor exists in men and women.
Yep.
But Susie, really, you really focus more in the field of women.
Yeah,
with
women's
floor.
pelvic health, exactly.
Okay, so I guess first let's start with what the heck are we talking about?
So I'll give you like a little, since we like the human body, like an anatomy overview.
Awesome.
So your pelvic floor, or the region of the pelvis, is basically where your two hip bones meet your sacrum, so your sits bone, and the muscles that kind of span underneath, they kind of make a hammock. Those are what we consider your pelvic floor muscles. There's 3 layers of muscles, but all to say that those 3 layers, all those muscles that connect to your actual bones, kind of make a little basket for all of your internal organs to sit on top of. So if we're going to speak about women, that would be like your bladder, your uterus, and your rectal system, or your anal rectal system. So it's basically those muscles that kind of help coordinate all of those systems. So whether it's having to go to the bathroom to do number 1, having to go to the bathroom to do number 2, or anything that has to do with the sexual function, usually your pelvic floor muscles are an important factor in those systems.
Perfect.
Yeah.
Okay. So, I mean, I find that the pelvic floor topic seems to be one that's growing momentum. Mm-hmm. And it seems very interesting. For me, I don't know, there's no depth of what I know about it like you would know about it. But I find sometimes I spot it. Mm-hmm. You'll see certain, like the way the hip hinges. Mm-hmm. I'm like, all right, I'm going to have to get you on speed dial.
Yeah.
Because like you'll see it with someone walking around, and a lot of times people just, we don't realize that a lot of things could start from like imbalances or pregnancy or imbalances.
Yeah. Like I think people don't realize that your pelvic floor is like a deep core muscle, right? So when we think about like the basis of your body is you need to be strong on the inside to be able to manage your bones and stack everything properly, to then be able to use the muscles that you kind of see, like your biceps and stuff. And when we think about pelvic floor, it's highly related to like your internal abs, like those deep ones, not the cute like 6-pack abs, like those are your rectus abdominis, like cool when you have them, but do you have the transverse abs that are underneath, that are the most deepest, closest to your internal organs? Are those strong enough to be able to make sure that your body can just stay upright properly? And often people don't have that good core strength. Sometimes they do, but sometimes we don't. And often when we're trying to figure out, at least in the physio world, when I'm trying to figure out like, well, what's wrong with you? Like, why are you having back pain? Or why are you having, like shoulder issues? Well, what's happening other than the direct issue? So your back or your shoulder. Because I'm specialized in looking more deeper into the body, I'll tend to be like, okay, like let's look at your pelvic floor. Let's look at what's going on in the deep core. Like, do you have that stability that the body needs to be able to do grander movements?
Because worst case scenario, if you work on the pelvic floor, you're just building a stronger foundation. It's like worst case scenario. It's like, oh, it wasn't that, but you'll benefit.
Yeah, exactly. You can't ever like mess it up. Like if you make it stronger, overall, you're just going to have, like you said, like the strong foundation of a house is like you want it to be solid. Right. If that's strong, you could always make it stronger and then just build on it.
Right. When I do, when I have clients come in, I have them do like a very specific dynamic warm up. Mm-hmm. And sometimes I'll have like a back day. Yeah. Like it's like an upper day. or even a chest day, and they'll be doing and they're like, do I still have to do the lunges with the stretch? And I'm like, yeah.
Yeah.
And he's like, why? And like, I'm thinking about someone specific.
That's okay. Go for it.
And they would say, they would question, which I love because I love to talk. And I would just quickly explain, like, like there's insertions from here to here, but we have fascia that comes right down.
Yeah.
So what we want to do is just get the whole body, warmed up, moving. So let's say we're in a press, it's beneficial for X, Y, and Z. And let's say we're in a pull, it's X,
Yeah.
So that, off that tangent, coming back on topic, what would be, like we spoke about, let's say their back is off and it's like, okay, it's too easy to go like sciatic. And then you're like, let's go deeper.
Yeah.
Now, apart from that, and let's go towards issues, what are some very common issues that someone could be like, oh, snap, I think I have
something wrong with my pelvic floor.
I think pelvic floor.
Yeah.
Well, everyone would benefit from this, but like someone go like, whoa, something's off.
And we got to go specific to the pelvic floor because, again, a dysfunction in your pelvic floor could also cause issues elsewhere. But if I say like just pelvic floor, and again, I'm going to speak about women because that's my forte.
Of course.
Like women in the urinary system, like, do you have urgency? So what is urgency? Like, you got to run to the bathroom. If not, like, you're not going to make it. Like, you feel like that urge constantly to need to go void, need to go eliminate your bladder. So that's something that we could work on because, okay, are the pelvic floor muscles so tense, so hypertonic if you want to get fancy, but so tense that they don't know how to properly relax and contract, that basically they're constantly sending a signal to the brain like, I gotta pee, even though it's not. It's just the muscles are not working with the brain, with the nervous system to say like, you're fine, everything's okay, stop clenching, like you don't actually have to pee. It's just your muscles are too tense.
Right.
You know, and that's like one example. And then you have the opposite. Again, I'm going to stick to the urinary system because I think it's the most common. You sneeze. A woman could sneeze and then she pees.
Yeah.
And then they're like, oh, it's normal. And I'm like, no, like it's not normal, but it's not like a good function of your urinary system. We don't have to go like,
that's life now.
Yeah. And a lot of people, especially postpartum, they have a baby and okay, give yourself some time right after a baby. Like, yeah, things are not working. They're not perfect down there. But years later, and they're like, yeah, every time I cough or I sneeze or I laugh, like I pee myself. And I'm like, okay, well, have you ever considered that something might not be in tip-top shape anymore down there? Like, was this an issue before? Is this a new issue? So that's like hypotonic muscles. So muscles that are often not strong enough to be able to close the urinary.
You took my words. I was going to say, so is that hypo?
Yeah,
but you have to be a jerk and just take the words away from the mouth. Okay, so then it's like overstretch causes basically hypo, so like less tension.
Exactly.
And then you have to go manual
kind of
stimulate.
teach it how to contract again properly. Because a muscle can know how to contract, not to get technical, but a muscle works at a certain length and tension, okay? So when you find that good length and tension, that's when you have a good contraction. For different muscles, it's different places on the curve, but overall, you just want to find that sweet spot that if you need a muscle to contract, it's at the right length and the right strength to do it.
It's so interesting because I know that when, for men, whenever they get anxious, one way, I think people in general, but for men, a lot of times in anxious states, we tend to urinate more often. Now that could be so many things, right from blood pressure and like what you would call like a pressor effect, where like you end up kind of eliminating. But because of this hypertonic, this too much tension, it's like I could imagine that if someone's carrying their tension in that area, I mean, if we take away the differences, as we know, when you go in, it gets kind of more and more similar, so all of a sudden I could see how too much tension could lead to urinary issues for men as well.
For sure.
If it's not to do with like sometimes blood pressure and things like that as well.
Definitely. The pelvic floor, even related to men, there's a huge field for it. I have a lot of friends, pelvic floor therapists, that work with males, especially males post-prostatectomy. So when they have their cancer and they remove the prostate, that muscle or that prostate is so connected to the muscle that once it's gone, the muscles are like, what are we doing? Like, I don't even know. Like, there was something in the way. I kind of used it to pull and contract against, and now it's gone. So The pelvic floor, like you said, very similar in men and women. Once you get, inside the anatomy, you kind of cut through all the layers. The layers of the muscles are pretty much the same, and the way they work are very similar.
Right.
For women, though, women hold a lot more tension in their pelvic floor as well in their shoulders. Men tend to hold it elsewhere, but still, in the pelvic floor area, they definitely hold tension there that can cause similar issues in their urinary system and in their rectal system, the way for women.
So what would be some, okay, so obviously if we tinkle, that could be like a symptom.
Yeah.
It's like, okay, wait, something's going on here. What other symptoms? Because it's a deep core, so could like lower back issues be a symptom?
Yeah.
And
often in chronic low back pain, if you've already addressed like that, it's not coming from the sciatic and it's not coming from a slip disc and it's not stenosis or it's not arthritis of the back, and I can keep talking for an hour, but if after those things have been ruled out, more than not, the pelvic floor is very weak.
does the pelvic floor, so when we have too much pressure, I was gonna do the whole me and you like going through the piriformis, but like let's say we have too much pressure on the like our sciatic, and we know we have those kind of like dermatome type of feelings, like, oh, I feel weird on my like leg.
Yeah.
Do we have these type of feelings with pelvic floor? Like, is there some sort of like radiating?
So again, it would depend where the issue is. Often it's around so for women, the vulvar area, so the vaginal area on the outside, and you have like your dermatomes as well there that radiate elsewhere, but usually it's pretty local to that local area, and like some areas of the low back could go into the legs for sure, because that's exactly where all the nerves are. So usually there's signs and symptoms of it. It's not the first thing that most people look at, because if you don't work with the pelvic floor, you're not going to be like, oh, like this is what it is. You might not have the thought process in your head to go think about the pelvic floor. Again, I specialize in it, so it's something that I try to bring into my work. But someone else who specializes in something else, like there's different techniques in the low back, like they're going to kind of use what they have in their pocket to best help someone based on what they know.
I love it, because whenever we think about really anything, let's say the most popular like in the world, low back, like it's like everything, but let's just say any issue, I love progression in the topic, because it's not that it's like a new way, it's just like now it's getting some more attention to be studied. And we could look at, like you said, it's like a deep core muscle where there's so many things we could do, and it could affect so much. Because if we think back about how I was talking about my clients doing the lunge and stretch just for everything, I don't really care what's coming up. I'll always kind of like, I still want you to do that one. It's because things overlap. And if we have too much tension on one thing, it could start to interact with something else. And then you have the battle of trying to tell to your clients or speak to your clients or elaborate and educate on like why this could be affecting. They're like, but no, my pain is over here. You're like, no, I understand that, but the knee bone is connected to the. You have to go sing the song.
That's like definitely something that is like a struggle. Sometimes someone will come in and they'll have like a knee pain, and I'll check their hip, and then I'll check with their pelvic floor, their core, and they're kind of like, what the hell is she doing? Like, she has no idea. She must be such an idiot. But you're like, just, hear me out. Like, give me a second to tell you, like, the way everything is going to work towards the lower body, or vice versa if we're going, hips up. But let's say, again, bringing back our knee, like, if you have a lot of core issues or hip issues, well, your knee's taking a lot of that load. The same way if your feet are not properly planted, that it's kind of giving all the same, stresses. Everything's going to be pulled in one way or another. So education for me and pelvic floor, probably I want to say like more than 50% of pelvic floor is education. People don't know what the pelvic floor is. They don't know what it's used for. They don't know what problems can arise from it. And they don't realize that the knowledge of knowing what those muscles are or what they're used for and how you could help them get better actually is the bulk of your therapy. Like, when I treat those patients, I always tell them, like, you have a toolbox and I'm trying to fill it with as many tools as I can. And my biggest tools is going to be when I give you the education of what is your pelvic floor and how could you treat it the best.
Yeah.
So one example is women, again, women comes to mind just because that's who I treat. People that have issues with their anal rectal system. So like going to the bathroom, chronic constipation. People are like, yeah, but you can't help me with that. It's just like what I eat. And I'm like, not really. I'm like, because if you have a hypertonic, so a lot of tension in your pelvic floor, it's really hard to like eliminate against a brick wall. If your muscles are really tight and you're trying to push against it, like your body's like, whoa, like I can't fight this fight. And simple thing, like I strongly believe in elevating, like using a squatty potty doesn't have to be that, but using a little bench to elevate your feet so your knees are above your hips. It just puts your pelvis in the right position to eliminate, evacuate properly. And it's a simple change that people, once they try, they're like, oh my God, it makes it so much easier.
Yeah.
Yes, along with like, okay, breathing properly. So we can get into that. Breathing is like probably the number one thing I teach in pelvic floor after the education part. I'll educate, I'll show them pictures. This is your pelvic floor, this is how it works. And then I go into like, let's see how you breathe. And breathing is probably the biggest indicator on if you have some sort of pelvic floor or any other issue. Because if you're not deep breathing with your diaphragm and properly contracting and relaxing those muscles in unison or in synergy with your diaphragm, you often see like people, instead of relaxing their pelvic floor when they have to pee or poop, they're like tense, they're clenching it. And I'm like, now you're asking your body to go through something, but you're stopping it. You're telling your body, okay, pee, but you're like, no, just kidding, because you're clenching those muscles. So teaching people how to breathe properly through your pelvic floor is like a game changer.
And allowing them to like fully eliminate.
Yes.
You know, so that's it's super interesting. One thing that I'm sure you would agree with, but sometimes just awareness is like a massive treatment tool. Like you just they never thought.
That's why I say like the education. Just I show them their pelvic floor and they're like, oh,
there's something there.
Yeah. We have muscles there. Like, yeah, it's not just a free floating space,
right.
You know, and that's it. Just having them be aware of what it is and how it works. It's a game changer. Because then I have my clients that go home and they're like, you know what, Susie, I was sitting on the toilet and I was really trying to think through it and be like, okay, I have muscles there. I really have to relax them. I have to breathe properly. And they're like, it was like a game changer. They're like, I peed and I felt like I fully eliminated. And then I was like, wow, like what a change. I didn't feel any pressure after that. Like 2 minutes later, I'm like, oh man, I gotta pee again. Like I really just focused on like relaxing everything and letting everything flow. And just like, I just felt so much better.
And for the washroom business where, you know, elevating the feet a little bit, like you see products out there that are being sold, which I didn't realize because at like 6'2", sometimes the washroom for me, I'm like, was this not a normal thing? My feet are, in Italy, you just came back. I'm like, well,
toilets are key for you there. They know what's up in Europe.
Yeah. So that all being said, are there any, maybe I'm putting you on the spot, but are there any simple kind of, nothing simple, but is there any exercises, like something that people could start doing, you know, in the meantime to reaching out to you or another pelvic floor therapist, specialist? Is there any exercises that they're like common enough, but no one really realized that like, oh, this could be beneficial?
Right. Honestly, everyone always jumps into the Kegels of it, but you got to know why. Like, is your pelvic floor hypertonic? Is it hypotonic? Like, what's the deal with it? Are we doing this exercise for the goal to relax certain muscles? Or are we doing this exercise for the goal to strengthen? So I always say, learn how to breathe.
Right.
Google diaphragmatic breathing, Google some sort of Pilates, some yoga, and do breathing. And just that will change the way you feel your body.
Right.
Once you start breathing and breathing with intention, again, you're not going to do it on your day-to-day world. You're not going to be walking around the streets and be like, and like trying to
understanding
breathe.
that the belly could come out when we breathe in. And
doing it enough so that it almost becomes innately done is just so important for you to be aware of when you breathe. Well, what do you feel? What do you feel expanding? Is it your chest? Is it your rib cage? Is it your belly? Is it your pelvic floor? Being aware of your body, I think, is number one. And then, okay, now I get it. When I breathe in, I'm trying to make my belly big. I'm trying to relax my pelvic floor. I'm trying to get air to enter. When I breathe out, I'm trying to contract everything, trying to force that air out. Yeah. Okay, I'm feeling the right muscles. Then you could go into your Kegels and your whatnot. But you got to feel it first, because you can do an exercise and not know what's going on. Don't do it.
It's just crazy because as this is happening and they're helping themselves with the topic that they came for,
Yeah.
then all of a sudden they're using, let's say, less accessories, like
Yeah.
so your intercostals and
Yeah.
whatnot, and the scalings, and all of a
Yeah.
sudden they're like, oh, my neck
That's
feels
better.
better, and
Yeah.
like I don't feel as
My
anxious,
chest,
and
the chest is open.
and all from diaphragmatic breathing, where it's just like the whole thing comes back to like the knee bones connect. Like you just keep on going, like, yes, it's all connected, and you really could approach this. And it's such an interesting topic, because as we started with by saying that it's something that even if you're like, okay, this maybe didn't really resolve what you came here for.
Yeah.
It didn't hurt you.
Yeah.
And now you have this moving better. You have maybe more hip mobility.
Yeah.
And there's all these things.
For sure.
Would you say that, well, early intervention's important for everything, but in the topic of, pelvic floor, why would early intervention, and let's make this simple because my wife's pregnant.
Yeah.
Not simple, more intriguing for me. I can tell her to go listen and she's gonna take notes. Why would early intervention, like pregnancy, why would that be something that would be beneficial?
Right. Pelvic floor, you're saying.
Yes.
So when baby is in mom's belly, it needs to grow. And where does it grow? It grows in your tummy. And what happens is your abs start to separate. Has no choice. They often start to get a bit looser. So that we're talking about mainly like those transverse abs and the six-pack abs. And a lot of women start to get like a diastasis recti. Not all women, but some, it's like the separating of the abs. And that just tells your body like it's getting ready for space for the kid, which is totally normal. But what you want to do to try to prevent maybe the sneezing and peeing and all the things that come after, sometimes after pregnancy, is you want to just make sure at the baseline, your muscles are kind of ready to receive what's about to come. So if it's someone who's pregnant and, planning for a vaginal delivery, well, you want to make sure those muscles know how to relax and open. If you want to make sure the baby's going to come out of the vaginal canal, well, it's like going to the bathroom number 2. If you're going to tense up those muscles when the baby's trying to come out, chances are you're going to tear, because the body's like, well, I still got to get this beautiful child into the world. Whichever way, it's just going to do what it has to do. But if you want to make sure that we don't cause so much trauma to those muscles, learning how to properly contract and relax and opening up that space is going to be super important during childbirth.
Yeah, I love that. I think it was very recent. Maybe I didn't even post it yet, but there was a video. I think it was a very short clip. And there was a video where I said that sometimes it might seem counterintuitive, but when we become strong in something, we also now have the ability to often relax something
else. Yeah.
So whenever we become a strong muscle is usually a healthy muscle, not necessarily hypertonic. We don't want to go to it's too strong. We got to learn how to relax. But a strong muscle and an engaged on purpose, a muscle engaged on purpose is a muscle that has more control.
Yeah.
And by having more control, you now could, I guess, for
use
this
it more effectively.
Right.
Yeah.
Now, that being obviously probably, I would assume it's one of the most common populations that would be very intriguing. Do you ever see benefit for this for like athletes or for people who are very active?
Right.
Is there anything that could come to mind? Or is it just more about like balance?
You'd be surprised how many sprinters or runners actually do pee themselves, because they have such hypertonic muscles. And especially, let's say a marathon runner during a long race, they're not going to stop to pee.
So many pee themselves.
Right?
Like, I mean,
are you speaking from experience?
No, but like, I mean, I have my history of my ultras and all that. And like, it's so often that it's not even a thing.
Right?
They're just like, oh no.
And they take it for like it's normal. And like maybe in that realm, like, okay, there's a level of normalcy, because like you're not gonna.
Nah, just because it's common doesn't mean it should be normal.
But I'm saying like they're not gonna go pee and ruin their chances of getting podium. I respect it, but because they've been trained. Now they've actually trained their body on not to properly eliminate, or to eliminate in the wrong times, or the muscles are so hypertonic because they were told like, well, you got to hold it in for the next 3 hours, figure it out because we're not peeing. Then now you've trained your muscles to not learn how to relax. So when it comes time to needing to actually eliminate, they don't know how. I
bet you as well, it's like, it goes off, but this is why I also love when teams work together, like health professionals, the multidisciplinary.
Yeah.
But I could see how when a pelvic floor, because as you're doing it, my head is thinking like, why do some people? Because sometimes people finish and they didn't have to eliminate. They never felt they had to eliminate, but they somewhat eliminated, and they would just kind of go like, oh, it's sweaty down there or whatever.
Yeah.
And it's like, it is what it is. No one cares.
Oh yeah.
But if you had the way we look at our gait in a run,
Yeah.
if we had a healthy and balanced pelvic floor,
Yeah.
I could see how everything else would engage and
Yeah.
track appropriately,
Yeah.
and just kind of, and even the dynamic and how the muscles end up looking as they strengthen.
Yeah.
Because we often see runners with very flat bums.
Yeah.
And all of a sudden you have to ask yourself, where's a lot of the strength coming from? Right.
Yeah.
So, well, it's a topic. I feel like we
Yeah.
don't have enough time.
No, but I have to like, just to go again, like on the pelvic thing, like for sure, if you don't have a strong core when you are running, you might not be like striking the floor the way you have to strike. You might be hitting the ground differently, and it might not be as effective energy wise for you to make it down that
100%.
I don't know how many Ks you're doing.
Yeah.
So it always kind of, everything's connected in one way or another. Again, you can always kind of look at someone and be like, this is probably the problem, but there's also probably this and there's also probably that. And I'm sure, like, I watch people walk in the street all the time, and I'm always like looking at them and I'm like, oh, I wonder what's actually wrong with them, because I see them walking and you could tell it's not perfect. But could it just be it's their back and it has nothing to do with their pelvic floor? Could it just be they have flat feet, but I can't see it because they're in their shoes? There's always so many things that are connected that could be a problem. But if you want to talk about running specifically, for sure, if you're not loading properly, if your
Yeah.
pelvic floor is not taking that stress,
Yeah.
then when you're trying to hit the ground, you might
Yeah,
not be doing it properly.
There's so many reasons for why these shoes have to get more and more cushion,
Yeah.
and why people are throwing their heels down into the ground. Where if we get into, I think the guy I used to listen to is Nicholas Romanoff, who was a coach to many Olympian runners, who came up with his pose technique, which is this way and this efficient way of running. Now, essentially, he's talking about coming down into the forefoot, like really not driving your heel.
Right.
But imagine, for example, like you learn it.
Yeah.
Sure, whatever. But imagine now for a moment that the pelvic floor is weak and the hips are tilted and the glutes are not activating. It's kind of like, okay, the person could understand the technique.
You won't be able to do it.
It's kind of hard.
Yeah.
The glute is not, and the hamstring is not.
You're gonna naturally, the body's like, well, I'm not engaging the right muscle, so I have no choice but to heel strike.
Right. There's like a
when I'm
lot
not-
of things that could
Yeah.
happen. Oh, so interesting.
Yeah. There's a whole field out there. I wonder all the time if, like, professional athletes, I know they all see athletic therapists and stuff, but I always wonder if there's a world of like the runners that actually see pelvic floor.
I think about a lot of things, like when I was speaking with Olivia, the Pilates teacher that I was speaking to you about just prior, and I had on the show not too long ago, the channel. I was really impressed because what happens is that I could see it's not when I'm not necessarily a fan of yoga, not because I think anything negative. It's just there's a lot of like holding and releasing, and
Yeah.
Pilates, I like the flow.
Yeah.
I like, it looks like some dynamic warm-ups, and I'm like, I like flow. Like I'm just not keen on like super
I think
PNF.
it always depends like what the need is. Like if
Yeah.
you're super hypertonic, you might need that rest, contract and rest.
Yeah,
to
the
actually,
PNF type of
Yeah.
See, that's the thing. I'm definitely not putting down it.
Yeah.
I'm biased and
Oh,
I
yeah.
like it. And then when I think of
I agree. I'm also
athletes,
like a movement person. Like I can't sit there in a hot yoga and just chill. I'm not like a
just
Zen person. I
it
need to
makes
move.
sense.
Yeah.
And when I think about the core, and then she also uses phrases like deep core.
Yeah.
And once again, it's like I could see how this multidisciplinary world comes together. And if you take like Olympians, and yes, they do see a lot of athletic therapists and physiotherapists. They
Yeah.
have a team usually, but I always hope for people to go like, you for sure could touch on that
Like beyond,
topic,
yeah.
but
You
work
have
with-
to, for sure. And I think like as a therapist, like you have to know what your limitations are.
Of course.
Like I speak of pelvic floor because I've done a lot of continuing education for it. I'm specific to women. I'm doing a conference in Atlanta the other month. So it's like something that I put a lot of time and effort in. If someone's going to talk to me about like cycling, like I don't know how to ergonomically fix you. That's not my jam.
Right.
I can help you for a specific problem if it has anything related to pelvic floor. But if someone's like, hey, Susie, like, how should I set up my bike, or how should I, get more power cycling? It's not my
Well,
thing.
in all fairness, you're better than his neighbor.
Yeah,
but,
probably. I mean, I
like,
hope, unless
you
the
can
neighbor's
set
like a
it-
triathlon.
You're gonna
but-
go. If knowing you, Susie has a memory like doesn't make sense. Okay, that bone,
Yeah,
right? You'll
yeah.
find it. You'll
It
figure
comes
it
back,
out.
but
Right.
I just say, like, I'm always someone who's very pro, like, try to stay in your niche. My niche is very much pelvic floor related. I do ortho as well, but if someone's going to come to me and they're a specific athlete to a specific sport, I always tell them, listen, I'm going to give you my knowledge as best as I can, but if you can find someone who's better suited than me, go for it.
Yeah.
If you can't, then of course I'll take you on.
And give me their number,
Yeah.
so you can like work.
Yeah. But try to find someone who's gonna, especially if you're a high level athlete, find someone who's like in it, that
Right.
knows, like a hockey player that knows what hockey movements are. I could speak on soccer because I play it.
Right.
Don't give me a softball player.
Right.
I don't know the sport.
Right.
I can break down how
Yeah,
you
you
throw.
can figure
I
it
can
out,
figure it
but-
out, but it's not my thing.
Right. You can help them in the meanwhile.
Yeah,
And try
of
to
course. You could always help
network.
someone, but I always say, like,
Find a specialist.
find someone who, if you can't, then obviously use your resources. But if you know someone who's better suited for X, Y, and Z, do it.
Yeah. So, like we started, and I said, I feel like it's a subject that's building and building and
Yeah.
building. What are we spoke about some misconceptions, but I don't think it's not understood. Yeah, I think it's not understood because it's not being discussed. So
Yeah.
why is it under discussed just because it's not new, but like
It's taboo.
it's taboo.
I'm like, that's exactly where my head was going, and I'm glad you brought it up. It's taboo. People don't like to talk about peeing, pooping, like
And you got-
intercourse. They're like not down for it. And the assessment and treatment is intravaginally or interrectally. Like I work within people's bodies. So already people are like, ooh, that's kind of weird. Like she's got to go up in there. Like, well, yeah, when you think about it, like, when a physio is treating your knee, like they can touch your knee, they can touch your quad, they can touch the muscle. Like if I want to treat your pelvic floor, like I can't, some parts of it I can treat from the outside. Other parts of it might need internal work. And that's the biggest taboo thing, is like people don't like to talk about it because it's uncomfortable. I have a client, and we actually met at bar class, so at a Pilates class, and she came to see me because she was having a lot of painful sex, so like pain during intercourse. And she's married and she wants to have a kid, and she's like, but it's so hard because I don't enjoy it, and it hurts, and I don't want to do it, but like what, all this stuff. And I'm like, listen, come see me, we'll talk about it. And it's scary for someone. They're vulnerable, they're putting themselves out there to you as a therapist, and they're basically telling you your whole life story. They're telling you like how they have intercourse with their partner, and like people don't like to talk about that. They don't know me. Like they might not want to be like, let me tell Susie everything about me and my husband Jimmy, and they're telling you their whole life story. So you got to make sure they're comfortable enough about it. But once you get people comfortable and they realize that there's some sort of benefit from it, like this specific client that I'm thinking of, she's like, I tell everybody about you. She's like, you changed my life.
Amazing.
She's like, people at work tell me all the time, like, no, it's just this, it's just that. They're like, no, it's not. It's not just this. It's not just that. But the older generations, it's hard to believe
Right.
that this is even a thing, because
Right.
it's so like
Yeah.
intimate. And they're like,
Yeah.
I remember when I told, then my boyfriend, my now husband, like what I do, he's like, what now?
Yeah.
And I'm like, yeah, like I treat women, pelvic floor, I treat internal. He's like, you what? And I'm like, yes. And I'm like, don't think about it as such a weird topic. When you think about where the muscles are, like that's what I have to do. And the more people get comfortable talking about it, I think the more people are willing to come see someone for it. And the more the word about pelvic floor and the benefits of it is spreading.
Yeah.
When I was studying, I don't know, 5 years ago, I remember being at a table with a bunch of girlfriends, and there was so many girls talking about all their issues, and I was just like cringing for them, because I was like, oh my God, like if only you knew what was out there. But I was just learning about it, so I was, trying to advocate for it. And now it's becoming more and more known, and I'm like, thank God more and more women or people are treating it. More and more women are seeking help for it, and it's like that's all you need is someone to do it, advocate, know that there's benefits, and then spread the word.
It must be, correct me if I'm wrong, it must be for women's pelvic floor.
Yeah.
It must be a woman dominated business? Because I could assume, I mean, come on, most women would be more comfortable.
Yeah, I
Come
don't
on.
know any men in the system. Not to say that there aren't. I think like most women are comfortable with women
But it's
treating them.
it's also, I don't want to say like,
They get it.
I can't, like, as a guy, I could do a lot.
Yeah.
But this empathetic approach of where I would say to women, like, when you have that feel, I don't know.
I was just gonna say they get it. Like a woman that might have
get it. Yes, sorry,
like
yeah.
painful intercourse. Maybe you're working with a therapist that also has that issue.
Right.
And they're like, I get it.
Right.
I'm gonna help you. We're
Right.
gonna get there. Or a woman that just had a baby and she's sneezing her life away and she's peeing all kinds. You might be with a therapist like, I've been there. Don't worry. Like we'll get you to a place where like you don't have to wear 20,000 pads when you're going to shop at the mall with your daughter because you're terrified that if you sneeze you're gonna wet yourself. Like they might be able to relate more on what's going on.
So what advice would you give somebody that they hear this, or they've been thinking and Googling, because everyone's
Google.
a doctor now, ChatGPT.
Yeah.
So someone realizes after they self-diagnose themselves that they're not dying.
Yeah.
And it might be something called pelvic floor.
Yeah.
So what advice would you give to somebody who's suspecting this? Would they go to their doctor first? Would they reach out to a physiotherapist? How does that system work? Let's say in Quebec.
Yeah.
Like, how does that work?
In Quebec, you don't necessarily need to have a prescription from a doctor to be able to come into the pelvic floor world or to see a physiotherapist to be treated for it. So if you find a clinic that has a pelvic floor physio, you can just call them up and say, hey, I think I have this going on. And they'll assess you and they'll let you know genuinely what's going on, what's wrong. I think the best thing is obviously just that. If you're going to use Google for something, like use it to Google a pelvic floor physio in your area. No matter where you live, I'm sure it's more and more common now that there's a pelvic floor physio, probably not even 5 kilometers away from your house. I can guarantee you, because I know as much as we're a small community, we're a pretty big community. I would say a lot of people coming out of the system right now, and I'll speak from McGill, is I know that they want to push pelvic floor even more. They're going into that system because there's a high demand for it and there's a high need. So I don't think it's hard to reach out to someone.
Now, if someone came to see you, would a client expect to do all of their exercises on your table, or are there take-home exercises that you prescribe and you work with them and they see you at whatever interval, and then they have to do homework? Is this the thing that they have to do homework?
100%. I think people, like as a therapist, this is the way I treat, and I think most of the pelvic floor world is very similar, depending on the needs. Usually at the beginning, we see our clients closer together. So at the beginning, I tend to see the pelvic floor clients every 2 weeks until I feel like they have a good understanding of what it is and what's going on. And then I'll push them to a month, and then I'll push them to 6 weeks, and then it's, on and on. But there's always homework to be done at home because it's a core muscle. It's an endurance muscle. It's a muscle that needs to be worked on every day. It's not like when you're training legs, you do it 3 times a week or depending what your protocol is, you're trying to build strength. Yes, you're trying to build strength in pelvic floor, but you're building it on an endurance type of way. So it needs to be done more often with less intensity.
Got it.
And I think people coming into the therapy world need to understand that a lot of the take home is, as therapists, we're there to educate you. We're there to teach you something. We're there to treat you manually if you're having a pain. But after that, you have to learn how to take what we've given you, bring it home, work on it, come back and see us. We could tweak it, modify it, and fix where maybe things are not going right. And again, if it's something like that needs our TLC and our hands-on, like for sure we'll do it. Like if I need to go into someone internally and stretch them, then I gotta do it. But I also teach women how to self-stretch.
Right.
Because if you're gonna come see me every day for that, it's gonna cost you a lot of money. I'll take the money, but that as a therapist, like that's not my job. My job is to teach you.
Right.
It's to teach you how can you manage on your own. Because eventually my goal is to let you go out into the world and manage on your own.
The term that I love, I heard it in one of my last classes, and my professor was nice enough to be one of my last guests on the channel. A doctor in physiotherapy, and specializes in pain.
Nice.
And I won't get into tangent. We don't have enough time for
No,
that.
I'll listen to
But,
it. I think I saw it came out. I gotta take a listen.
Nonetheless, it was the first time I heard a term that I was like, this is who I am.
Okay.
This is who I am. And that was Therapeutic Alliance.
Yeah.
And I was like, man, I love that. I'm about to tattoo it on my neck.
Yeah,
Therapeutic Alliance.
on your chest.
Yeah, exactly.
No regrets.
Yeah. No regrets. And I hear this and I see how with Therapeutic Alliance, what happens is that when somebody comes to somebody with an issue and you're doing your job and you're doing a good job, but you care.
Yeah.
And you work with them, and if they could only afford $100 a month or they could afford $500 a week, it's like, I'm going to work with what you got going.
Yeah.
And we're going to, from this moment, we're going to inch forward in the right direction.
For you.
Exactly. And you build that team and just that, the education, the
Therapeutic Alliance for people with pain. So whether it's chronic pain, fibromyalgia stuff, or pelvic floor related issues, it's probably, I would say, one of the most important things of your professional career.
Agreed.
If you work in those specific fields where people are suffering,
right,
they need to know that you got their back.
Yeah.
That's honestly, that's all they want to hear, that you are going to try to help them.
Yeah.
And I always disclaimer to people, I'm going to try my best. I don't know what the outcome would be, but I am going to try my best with you by my side, doing the exercises with me, helping me help you.
Yeah.
I'm going to try my best to help you. And when they just hear that you have their back and you're listening to their pain, because a lot of people come to me, especially in the pelvic floor world, they're like, I saw my gyno for 3 minutes. They put a speculum in, which as a man, you don't even know what that feels like.
No.
They're basically opening up your cervix with like angry teeth. Okay.
I'll delete that from my brain.
Yeah. And your poor wife is going to be going through it a lot right now.
Yeah.
But it's so aggressive. And the women that come see me are just like, they don't care. They don't care. They go in there and yes, it's their job. They got to kind of do what they got to do. They got to do your pap test. They got to check if things are well. But as a woman, you're just like, give me like a second to like get used to what F you're about to do. And that's all they want. And I say like my pelvic floor or most pelvic floor women are treated for about an hour because you need to give them that time to one, get used to you being in their space, in their very personal space. And I tell them all the time when I'm treating, like if at any moment during the therapy, you are overwhelmed, you want me to stop, it's a hard stop. We're done. Yeah. I don't need to push through anything if it's very uncomfortable for you. And we have the luxury of doing that because I have the time. Yeah. But that's what people want, that alliance and that trust. Yeah.
Perfect.
So important.
Look, I mean, obviously it's a topic that we could endlessly talk, right? Because it just affects everything.
100%.
But let's finish on this. I will put all of your information in that space below, wherever it is, for information to contact you. But what's the best way for people to contact you, see if in your busy schedule, if they could fit in, or if you could take them on, or is it Instagram, phone number? What is it?
Both. I'm pretty good with answering my phone. I probably have to become better at like disconnecting, but like business is business. You're always going to be answering. Instagram, I have my Instagram. It's Susie MTL Physio. I think that's what it is. Probably got to double check. I'll send you the info.
It's all down there. Yeah, exactly.
It's all down there.
Yeah.
My phone number for sure.
Okay.
We obviously reach out to you if they want. I'm usually pretty quick at answering communications.
If not, you're getting married in Italy.
If not, which already happened. Exactly. And I was answering an email the day before I got married, so don't even. Don't tell my husband. But it was like, I'm pretty good at answering emails. If anybody wants to contact me, whichever way is comfortable, either Instagram, text message, phone call. Usually text message is better because if I'm busy, I won't necessarily answer my phone. So send me a text and I'll call you back.
Cool.
And
awesome. Well, thank you so much.
Thank you for having me.
I wish we had more time for sure. But I think we're going to have a second conversation sooner or later. I already have clients that are ready to reach out for sure.
So I'm always there to help.
It's a topic that I'm excited that I have somebody in my professional entourage that I could utilize.
Crazy where we began from.
Crazy where we began.
Just trying to activate my glutes. So here we are.
Here we are. All right. So thank you so much. Thank you for tuning in. And until next time, I'll see you guys. And if you need any pelvic floor, well, you know who to contact.
Thanks, guys.
Susie. All
Ciao.
right. Take care. Bye-bye.